Beat with Dr. Benita Zahn.
February is Heart Health Month, and that means we've got to pay attention to our blood pressure. I know we've just recently spoken about structure of the heart, but blood pressure is very important for heart health, and Dr. Craig Hersh with Empire Blue Cross, the Chief Medical Officer, joins us to explain, and I guess also, Craig, to keep our numbers in the safe range. Good to see you again.
Nice to see you, Benita.
So we have been told for years, 120 over 80, 120 over 80, those are the numbers we want to hear. But in the last few years, we've been told, those are a little high. Talk to us about what those numbers mean and where we really should be.
Right. So the actual numbers, the recommendations are less than 120 and less than 80. Anything above that is considered either elevated blood pressure or hypertension, stage 1, stage 2. And essentially, the higher it gets, the greater the risk is to you over the long term.
Why the move to lower it? What value has been found if we go to what, 110 over 70?
Yeah, so with each decrement of millimeters of mercury, with each lowering, you decrease the risk of the complications of high blood pressure or hypertension. And those complications tend to be threefold: heart disease, strokes, and kidney disease. And heart disease being the number one killer of people in this country. And so that's the one that we're really trying to prevent.
Dr. Hersh, I think a lot of folks don't understand, the progression. So your numbers are, and people say it's just a little high. What does every little bit of little high do to the structure, the health of the arteries around our heart and in our body?
Right. And so what happens is with high blood pressure, your heart is pumping against increased resistance, and it is a silent condition, right? They call it the silent killer. And the longer you have that, the greater the risk that you're going to develop complications, things like congestive heart failure or strokes. And I'll be honest, I've treated a lot of patients with that, but this is personal to me. Both my father and father-in-law suffered complications of high blood pressure that wasn't well managed. And as a result, they ended up, in a bad spot.
Well, I can concur with you. My dad had hypertension, and eventually it ended his kidney function. And he spent 7 years on dialysis. And so when someone says to me, it's not so bad, I go, yeah, it really can be that bad, because Pops wasn't that bad, but untreated or not treated well. What is it? What's the mechanism by which we develop hypertension?
Well, there's some complexities physiologically, but what contributes to it over time, for the most part, are a number of factors. Genetics plays a big part, but beyond that, environmental factors. Obesity is huge. And then once you have elevated blood pressure, you need to really be very careful about certain things to be able to control it. For instance, your diet. You need to be on a low salt diet, low fat, high in fruits and vegetables and grains. Most common diet is called the DASH diet, which is a dietary approaches to stop hypertension. The other thing is exercise. Being sedentary really contributes to developing worsening hypertension over time, or unmanaged hypertension. And if you have that, you're much more likely to develop the complications over time.
I think genetics was the problem for my dad, not being an obese person and not being a smoker. And smoking is another issue, isn't it?
Absolutely. And fortunately, we've seen such an improvement in the smoking cessation over the past 10 years. And what we're hoping to do is see a similar movement with hypertension or high blood pressure over these next 10 years.
For people who may have been obese at one time in their life and now they've lost weight, we've seen the bariatric surgery end type 2 diabetes for many of those folks. Do we see a correlation with the reduction in hypertension?
We do. As you lose weight, you're going to improve your health outcomes. But like I said, it's not just the weight. And over time, those arteries get stiffer. So you need to do other things besides just losing the weight, like making sure that you have the proper diet, that you're not living a sedentary lifestyle. And if you're taking medication, you should take your medication and even during a time of COVID, you need to be sure to get in to see your doctor.
And you mentioned COVID. It's also hypertension is one of the risk factors for having worse outcomes if you do, in fact, become infected with COVID.
No, it's true. So listen, in the Albany region, the prevalence of hypertension is 36%, right? 1 in 3 adults has hypertension. And if you look during the time of COVID, the mortality associated with the complications from that is up 30%. So it's a bad combination to have high blood pressure during the time of COVID.
And a lot of conversations now, rightfully so, about racial disparity in healthcare, and for African Americans, hypertension is a particular health issue.
No question about it. African Americans, Latinos, minority populations, impoverished folks, that definitely contributes to it. And you can imagine over a lifetime, the choices that are made, maybe they're not choices, but the situations that develop put people in harm's way over and over and over again.
You live in a food desert, and you're stuck eating what, the high-fat food that may be easy at the fast food or, pickup kind of package stores. And that doesn't help as you're trying to follow, as you point out, the DASH diet. Dr. Craig Hersh, always a pleasure to talk with you, breaking it down for us, especially during this month where we are more aware of our heart health. Thank you.
Thank you, Benita. And one other thing I make a plea for.
Yeah.
This is an ambulatory blood pressure monitor. Mm-hmm. This is the best way for people to check their blood pressure at home, which is even more reliable than when you go into your doctor's office. And if you do this, you really can do very well even with a telehealth visit. And I just want to let you know that Empire and other insurers certainly make that available if you can't get in to see your own physician.
That's wonderful. We can have a conversation about that. And I don't think that cuff thing, little wrist thing, works so good on people with little wrists. But it's a start, right?
It is, and you can get the one that goes on the arm. So
there you
however
go.
It works for you.
Dr. Hersh, thank you so very much. He's with Blue Cross, the Empire Blue Cross, the Chief Medical Officer. And thanks for joining us. We'll see you next time.